We're proud to bring together such powerful voices today, and we thank our esteemed panelists for their leadership and dedication to this work. We hope this discussion will spark new ideas, deepen understanding, and continue to move us toward a city where every resident feels safe, valued, and supported. First, we have Stefanie Mavronis, the Director of Mayor's Office of Neighborhood Safety and Engagement, which most of us might know as MONSE, where she leads Baltimore's first multi-year citywide violence prevention strategy under Mayor Brandon Scott. A lifelong Baltimorean and first-generation college graduate, Stefanie previously served as MONSE's Chief of Staff and as Communications Director for the Mayor in the first year of his term and during his tenure as City Council President. Her leadership at MONSE spans violence intervention, victim services, re-entry, youth diversion, and neighborhood stabilization. Before entering city government, Stefanie worked in public radio and taught courses at UMBC and Princeton on Baltimore history and community-based public safety. She holds a dual BA from UMBC and a master's in public affairs from Princeton University. Welcome, Stefanie. Thank you so much. Next, we have Joni Holifield, the founder and executive director of HeartSmiles, a nonprofit established in 2015 following the murder of Freddie Gray that's dedicated to empowering youth in underserved communities through leadership development, entrepreneurship, and mentorship. Joni has built a thoughtful and dedicated team at HeartSmiles, who runs several citywide initiatives and partnered with a multitude of institutions to expand reach and impact. Prior to founding HeartSmiles, Joni enjoyed a successful 2-decade career in corporate leadership. She is a native of West Baltimore and also known for her motivational series where she shares daily insights to inspire youth towards personal growth and resilience. Welcome. And then we have Adam Rosenberg. He serves as the Vice President of Violence Intervention and Prevention at LifeBridge Health and is Executive Director at Center for Hope, where he leads a $15 million plus division that supports over 10,000 survivors of violence annually. With over 2 decades of experience in law, child advocacy, and nonprofit leadership, Adam is the founding architect of the Jill Fox Center for Hope, a nationally recognized model for trauma-informed care. A former prosecutor on domestic violence and child abuse cases, he's helped shape public policy, secure landmark legislation, and expand services to vulnerable populations across Baltimore and beyond. A graduate of Cornell, go Big Red, and Cardozo School of Law, Adam currently serves on the National Healthcare CEO Council, on Gun Violence Prevention, and the Ad Council CBI Advisory Council, and has been recognized by the Daily Record and Baltimore Magazine for his leadership in public health and safety. Welcome. Now you can see a mouthful, 3 very impressive resumes. All right, so to start, can each of you please share what brought you into this work and what drives your commitment to violence prevention in Baltimore? Can we start with you, Stefanie?
Sure, thank you. A couple of things bring me into this work. I think doing what I do today is not what I thought I was going to do. It's not what I woke up one day and said, like, oh, I want to be the director of this agency. I think that was not in my sort of in my train of thought at all. But I came to this, I guess, in 2 different ways. One, it mentioned my background in public radio. I spent 4 years really hearing from people who are on the front lines of this issue, people who are working towards community-based solutions for violence, different ways of approaching public safety that went beyond the role of policing, prisons, and prosecution. And at that time, there was really a lot of momentum at the grassroots level, but it hadn't reached the heights of government. There were a lot of people who were survivors of this issue speaking about their experience, a lot of people talking about the gaps. And so hearing that and really being immersed in that and seeing what was coming out of the advocacy and service community inspired me to want to play a role. I got directly involved really through Mayor Scott, who at the time was a city council person and was trying to put on paper as public safety chair of the city council the first ever way of looking at violence as a public health issue. And so I worked when I was a student at the time to help him piece together that vision and put it on paper and start to build some momentum around what that could look like. And then had an opportunity later on to work directly with him and kind of stayed connected to the work through there. But for me in particular, I look at the issue of violence too through the lens of justice and equity. I think in a city like Baltimore, especially being a white person in Baltimore, white and black experience in the city are really different. People have really different levels of exposure to the issue of violence. And I think one of the things I noticed as someone interested in policy and politics, when I was first getting into this work is that a lot of people in Baltimore, they may say, white people may say public safety, it's a big issue. But when you talk to Black communities in Baltimore, there's such a different kind of personal connection to, like, I've lost someone to gun violence, I've had this issue happen to me, and I was really fascinated in why those experiences were so different, and knew that we needed to find a way to bring that together so that this wasn't a siloed issue that only some communities were impacted by and cared about, but that everyone understood that violence is going to be a limiting factor in our city's future if we don't find a way to collectively prioritize this and focus on it. And so I think personally that's kind of how I also got focused on this issue.
Thank you so much. Joni?
Yeah, absolutely. So I gotta be real with y'all, and I have to talk to y'all like family because I really don't know another way to explain like these important issues. I got into this not for a career. I got into this as a commitment. I hated Baltimore. Like, I was one of the ones who grew up in West Baltimore, 21217, one of the poorest zip codes in Baltimore, and I hated every second of my life. Violence was just a normal thing. I didn't realize that it was unnormal until I got older, but in that apartment, I could still hear the gunshots coming through our window. Like, we had to be trained by our mom that when you heard gunshots, you roll off the bunk bed because the bullet either want to hit the wall or hit your head. And thank God it always hit the wall. But that was just a normal part of what we went through. I buried more childhood friends than anybody should ever be able to say that they went to that many number of funerals before you hit 16. I had people around me in school, teachers, telling me how stupid I was and how dumb I was and how I was never going to be anything. And when I looked at my family who struggled with drug addiction and alcohol addiction, and when I was growing up, it wasn't this thing like, oh, let's get them some help, like this is a healthcare issue. No, you was getting locked up. Like, you were going to jail, and if you didn't have the money to pay whoever you were supposed to pay, they were busting into our small apartment, beating you and dragging you. Like, there was just so many things that I saw, and it made me hate my life and hate the whole situation. But luckily, when I found my way to a McDonald's, they saw me and they saw who I was. Like, I stopped going to school in the 9th grade, and it was the first time that somebody called me a leader at McDonald's, and they kind of helped to groom me for corporate America. And I was lucky enough to be able to get a job at Comcast at the minimum level. That's a whole nother situation on how I got there, and I'll tell y'all that after if you're interested. But long story short, I ended up in executive leadership position that I was not qualified for on paper, but they saw my natural raw talent, and that was how I lifted myself out of poverty. So I gave Baltimore my middle finger. I moved. I went to Anne Arundel County. It wasn't that far, but it was far enough to where as though I didn't have to deal with or see city life. And I was about to celebrate 15 amazing years in my amazing career when Baltimore City Police killed Freddie Gray in the same zip code that raised me. And even though I still had so many hard and negative feelings about Baltimore, I couldn't be on the sideline. I couldn't be one of those people who was just complaining about how young people was handling that situation, but not actually make myself part of the solution. And truth be told, y'all, like, that was me. Like, those kids were me. If the Freddie Gray situation had happened while I was a young person, I would have been right there burning down police cars, throwing rocks, and doing everything because I was angry and I was upset. But I was also, as a young person, the type that just kind of suppressed all my feelings, so I never let it out. But given that same situation, y'all would have saw me right on TV being locked up right with them because it just wasn't right how we were treated and how the system, if you will, kind of just made us feel about ourselves and about who we are. So this is a deep, deep personal commitment to me, and I wish that the work didn't have to be done, and I wish I didn't have to be here because I wouldn't.
you? What brought you to this work and what drives your commitment to violence prevention?
You know, central to a lot of, I think, my philosophy with work and what's created Center for Hope was defending childhood. And that there are so many things that can interrupt that childhood along the way, exactly as Joni just described here. And I believe still that's why I do this work. I think like everybody else here, none of us planned to be sitting here today necessarily doing this. I was grateful to get a job in 1997 as a prosecutor in the State Attorney's Office, and you know, was just happened to be placed anywhere, and they assigned me to the Sex Crimes Division in 1997. This is before there was Law and Order Special Victims Unit or CSI Miami. No one was talking about sex crimes like they do every hour on TBS now. And it was transformative. I really saw that there was so much more we could do for the public good to help kids who've been victims of sexual assault, domestic violence, trafficking, exploitation. And that's where I, spent my career focusing on victims of crime, people who had been hurt by the people who, cared for them the most. I left prosecution, went to run the Baltimore Child Abuse Center, the city's child advocacy center, third oldest in the nation, first in the state of Maryland. The program dates back now almost 40 years. And we gave this incredible wraparound treatment for kids who've been victims of sexual exploitation. Around 2012, I was invited to participate in Attorney General Eric Holder's Defending Childhood Initiative. And it was there that I really, for the first time, learned of exactly what Joni describes here, is that there's a whole other group of kids who live with gun violence, whose normal night isn't normal, and has to learn, has to sleep essentially in such a low state that if you hear gun violence, you've got to roll to protect themselves. Those kids, when they were impacted by gun violence, weren't getting the same wraparound treatment that these kids who were victims of sexual abuse and sexual assault were getting. And that didn't seem fair. And we knew that the poor outcome, the adverse childhood experience outcome of the abuse cases and kids who were growing up with violence were very similar. And it really became a driving principle that why don't we give all these kids the same best possible treatment that we possibly do there? And that's what drove us to move the Baltimore Child Abuse Center as a small, scrappy, standalone nonprofit that BCM supported to join LifeBridge Health and to really take a public health mission towards it, that all these kids who were impacted by trauma and violence and abuse deserve the best possible care we can get them. That we looked at maps and we saw where kids had been victims of sexual violence was also the same neighborhoods where there were high levels of gun violence there. Also the same levels of all of our other poor outcomes. It was the black butterfly that was overlaid upon the same sexual abuse map, and no one talked about that. And so that continued to then drive us, that as we built Center for Hope in 2019, LifeBridge Health invited us to join them. They saw that we had a shared public health mission to let's keep kids healthy and keep them out of the emergency room. Look at healthcare, we don't want you in the emergency room, right? We want you out on the street healthy and happy. And it became pretty clear that there were other ways we can impact and defend childhood by collaborating and breaking down walls and starting to work with our domestic violence organizations within LifeBridge Health, our community violence organizations, and that's why we started running safe street sites and responding to gun violence there, is because those same kids who were living in that neighborhood also, if I remember my numbers, 21217 is probably the number 3 zip code of kids who've been victims of sexual abuse living there. And not any fault of the neighborhood, it's just where kids were clustered and gathered. Dozens of them. And so we wanted to make sure we could provide that support for them. And so when the call came to take the chance, we took on a bigger mission to not just focus on children, but what are the other systems that impact children. And that was why we took on 6 safe street sites to manage that in conjunction and partnership with the mayor's office, and why we run domestic violence programs, and why we also said, we've got this great mechanism, how do we also help with elder abuse? And we started to look at all victims of violence across the spectrum there, and that everybody deserves the best possible treatment there. But for me, my true north is still defending childhood, making sure that these kids, and how do we connect them to systems so that those kids, after we've done that intervention, for gun violence, sexual abuse, witness to domestic violence can make their way to the Pratt Library, make their way to Big Brothers Big Sisters, make their way to a program like HeartSmiles, so we can get them that. One of the key things that gets kids out of trauma is that one mentor, that one person who cares for them and gives them that direction there. So how can we help with that? We don't do it ourselves, but let's make the referral and provide the therapy and the treatment and support and help lead that conversation. We don't have to do it, but it helps to host it. So.
Thank you so much.
Thanks for that.
Our next question is for Joni. So given your lived experience that you shared with us, what does violence prevention mean in the context of the work that you're doing at HeartSmiles?
Yes, thank you so much. So what started as a one-person show is like now a full-blown organization with 80 people on the payroll, if y'all could believe that. But here's the best part.
80 go.
Yeah. But here's the best part. 75 of those are all our heartbeats. And our heartbeats is what we call young people in Baltimore who have gone through our program, who consistently demonstrate the leadership skills, the personal development, the professional development, all the things that we teach and train them about. So imagine these young people talking to their peers in the neighborhood about what it means to take a positive path and what it means to craft your own version of success. Because the conversation about violence doesn't even need to be had when you feel safe. Psychologically, emotionally, mentally, you feel good about defending yourself physically. But your mind is focused on your future and where you want to go. That violence intervention and conflict resolution and all that stuff, those are important conversations to have, but those conversations are had as a part of this bigger picture of what type of person do you want to be? What type of leader do you want to be? Where do you see yourself in this world? And if you see yourself in a better place, then you know what? Let's talk about emotional intelligence. Let's talk about anger management. Let's talk about who you are under pressure and under stress, and giving young people real tactics and skills that they can use in the heat of the moment, because most of these issues that happen that result in somebody losing their life isn't because of some big issue that's hanging on somebody's head. It's 3 seconds of anger, 2 seconds of forgetting who you are, or losing just a handle of your emotional state. So a big part of our work when it comes to violence prevention is first understanding who that young person is and what their version of success is. Not trying to stuff them into a box and say, oh, you can only do this trade, or you can only learn this skill, but really trying to figure out what is your version of success, and then helping them make those meaningful connections, because now you got something to work for. You live your life very, very differently when you don't have nothing to lose and you don't have anything to work for. And we see it as a ripple effect, because as much as I can communicate and talk and relate and all that, the fact of the matter is a peer, especially a young person, is going to listen more to another peer than they ever would me or any other adult, regardless of how right we are, how many valid points we got. All that is going to go out the window. But imagine your peer holding you accountable. Imagine your peer saying, look, I see you got that ski mask, take that off, because that ain't what we do here. Seriously, and like so many fights and potentially dangerous situations have been avoided simply because we had a young person who was either a heartbeat, or they knew about HeartSmiles and they were feeling the message and they understood and they got some of the tips and tools, and they started to diffuse the issues themselves. So what we've effectively created really is this ripple effect. On the streets, young people are telling each other, man, why would you ever risk your freedom? Why would you ever risk your life for this little bit of money when we can make more money working with HeartSmiles, doing something positive, building ourselves up, and also doing things that we want to do. So it really is like our strategy, this idea of really working with the whole person in terms of the young person, and just helping them to see differently and to think differently and work towards something that they care about and that they love. You see a totally different person.
Thank you. So we hear about how approaching the whole person as part of your strategy, and that shifts a little bit from some of the traditional strategies. And so for Stefanie, you also spoke about justice and equity and racial relations in the city. So keeping that in mind and knowing that there isn't one size fits all solution, how is the mayor's office approaching violence prevention and intervention differently from some of the traditional models?
That's a good question. I think in a couple main ways. So our agency is relatively new. Mayor Scott established us in one of his first acts of being mayor back in December 2020. Our first director in the office came in January 2021. And we very intentionally had to set out by not only building the foundation of our work, but also getting the right people around the table. When our agency was created, it wasn't just about helping oversee initiatives like Safe Streets or some of the other work that we do, but it was also about being an interagency accountability partner. Our approach differs from what's traditional because not only are we looking at violence as a public health issue and looking at it through that frame, so if you think about, like, remember all of the messaging we saw, all the peer work that we saw during COVID, literally trying to address the social norms aspect of it, the cultural norms aspect of it, but also getting to that direct person, finding the person who can deliver that message like Joni spoke about. That's very much at the heart of the work that we do and how we do it. How do we address the root causes of violence? So not just waiting until an incident happens and then policing, but making sure that we are getting at the root causes. Why is this young person acting out, like Joni said, or what is an effective intervention with this adult who maybe has been in a lifestyle that's putting them at risk of violence, putting their family at risk, who's maybe ready to make a move and make a change, but they don't know where to go. That's where we kind of come in and play a role in intervening. But in addition to that work, for Mayor Scott, it was important that we were an interagency accountability partner. So that looks like everything from making sure that we're addressing some of the environmental factors in communities. We work directly with Department of Public Works, Department of Transportation, all of our operational city agencies, who you might think, like, what role do they have to play in violence prevention? Well, for us, we really see it as an all-hands-on-deck approach. The environment needs to be correct. We need people who are out addressing our communities, pouring into them, especially bringing up equity and sort of racial justice in this context. We know we've had communities in our city that have been disinvested in for generations in some cases. And so we're starting from a different kind of baseline, but we have to do that work to pour into not only our people, but also into our neighborhoods so that we can start to transform. We have to find ways to get people to work. We have to talk to Rec and Parks and Department of Public Works about how can we open up more slots for our returning citizens to have employment with the city when they come home. Like, all of these things for us are a piece of how we address violence prevention, but really taking that all-hands-on-deck approach, taking that role as a coordinator and convener, helping get agencies that are used to being siloed to work together. I think that's how our approach differs. And for us, I think something we're really proud of as we look at the data and we look at the models for a variety of our work. These are evidence-based approaches, and there's been people who have researched some of these models, researched some of these initiatives before. We know they work when the money is there to invest in them, but in the city of Baltimore, we hadn't had that foundation, and certainly not from the mayor's office level. And so it's been work to kind of get this approach together so that we now today have a strong foundation. We now today have a body of work that's addressing this issue from, prevention, intervention, rehabilitation, re-entry. We're a non-law enforcement agency, but we are in the public safety portfolio. And so I think for us, that in and of itself was a little non-traditional, like having a non-law enforcement agency playing a role in public safety. It took us some time to also build our credibility with our law enforcement partners to understand the work that we do. But now we're at a place where law enforcement is coming to us and saying, hey, we think there's room here for prevention. We think we want to understand what Safe Streets does. Things that even 10 years ago were kind of unthinkable as far as that relationship. There's now an understanding that there's a much wider breadth of the public safety conversation. And so that's kind of the work that we do. I see it as cultural change, but then also really pouring into this all hands on deck community first approach.
Thank you so much. Next one is for Adam. So you explained a little bit about the way that Center for Hope works, and also you span the lifespan. So you started with a passion for children. You also included elder abuse in that, and so we heard a little bit about how that's unique. So keeping that in mind, what are some of the key ingredients that you feel make the violence prevention program truly community-centered with Center for Hope? And why do you think it's effective?
So there's a few areas that make us community-centered that by design, Center for Hope is Baltimore City's child advocacy center. We're the spot for 40 years that Baltimore City's coalesced around when investigations of child abuse occur. And so rather than law enforcement or social services or prosecutors having to essentially have a room like this with a survivor of abuse sitting in front of every one of you asking questions of tell me what happened, tell me what happened, we've made it a coordinated approach, passed the laws actually to solidify that as well. We funded it in the last 30-some years. But it's community driven in the sense that we're working with whether it's foster care, whether it's caregivers, parents, kinship care, the family members, to be able to help lift that kid back and get them back to what they want to be doing, is being a kid again. And so trying to find those local resources in those neighborhoods that child, that family can support with. What made it such an interesting partnership when we took on the Safe Streets program is now we also, in addition to just going to communities and neighborhoods, what we would do a presentation in a room like this around how do you prevent abuse from happening, or how do you talk to your local school about preventing child abuse and protecting the children in your care. Was now we had a team of trusted community violence interrupters who were from those same neighborhoods that they are working in now. And these are returning citizens who, were giving them jobs and a chance to turn their neighborhood around. And they, in their heart, want to turn the neighborhood around too. And they're working with child advocates, so they're also, I think, keenly aware of, the safety and well-being of the kids in those neighborhoods too. Certainly, all of our violence interrupters or Safe Streets teams have a passion for youth work and keeping kids and engaging kids in program. But now we had an additional resource to be able to provide that extra level of whether it's therapeutic care, whether it's a structured after-school program, or whether it's an intervention if there's a reason to believe that trauma or abuse is out there. They could connect that. And that's really plugged us into 6 neighborhoods throughout Baltimore City. 3-4 of them are really right around Sinai Hospital too, which is where Center for Hope is. Footnote on that, the old building we used to run was right smack in the middle of the city. If you had like a dartboard and it was bullseye, it was 23rd North Charles. Cool, convenient location, the old Goucher College dorm. But it wasn't really a neighborhood. It's not a large community of people living in old Goucher, but kids. When we moved to our current location, or we're looking to track at 5400 Preakness between Sinai Hospital and Park Heights, now we were suddenly next to a neighborhood where there were kids. And so it puts us in the neighborhood where there are children being seen, by our community violence interrupters, by our community outreach professionals, or by our colleagues in the hospital who rely on Sinai for healthcare. And then extend that to, we're also running Grace Medical Center, so we've got a Safe Streets team down there, we've got violence responder teams down at Grace, and so we're connected in neighborhoods too. So it allows us to look at citywide, and also allows us to look in certain neighborhoods and spots there to be able to have a focused intervention when necessary, to be able to spin efforts there.
In 2024, Baltimore reported 201 homicides, which is the lowest annual since 2011, and experienced a 34% decrease in non-fatal shootings compared to 2010. These improvements have been attributed to collaborative efforts between city leadership, law enforcement, community organizations, including initiatives like the Group Violence Reduction Strategy and Project Safe Neighborhoods, for which BCF was also an early supporter. So that said, I want to throw this out to anyone that's interested in answering. What else can successful partnership look like across sectors, other than us being on this list?
I think for me, and it's amazing, I think we're seeing some of the fruits of our labor come to fore now that were just dreams a couple years ago. I still remember when Mayor Scott was first running for office and said we're gonna get an annual 15% reduction year over year on homicides and shootings, and everyone was like, you're crazy, that's never going to happen. We didn't get there the first year. The second year we saw some slight reductions, and now for the past 2 years we've seen 20% or more reductions year over year, and are currently still trending above 20% reductions this year, year over year, and like going up against our best work in some cases. I think for us, we think about this a lot in terms of coordination. So not only better communication across those partnerships, but also coordination. How are we knowing what each other does? There's so many people that work in this space, and I think for people who are from the funding community, and you appreciate this, that there's historically just been a lot of competition in this space. Organizations didn't necessarily have the incentives to work together. They weren't necessarily being engaged under like a common banner of that work. And so there was a lot of repair work, quite honestly, that we had to do at the start of the term just to get everyone together at the same table, to understand we're not here from a competitive purpose. We're actually all going to be stronger if we can come here together under the same shared goal of doing this for our young people, for all of our residents. And today what we see is such a higher level of coordination than I think we've maybe ever seen in the Baltimore kind of community-based landscape around this issue. For us, we want to continue to like support and foster that. We're thinking about how we can share data, how we can streamline referral pipelines so that people are actually getting the support that they need, but it also starts from us knowing what each other does and kind of what everyone has to offer to this ecosystem that we really want to build here in Baltimore, and we continue to see that grow and flourish and develop. But I think for me, like figuring out how we push back against some of those instincts around competition and really see ourselves as working together under the same banner, that is the reason why we're seeing the results we're seeing. It's no one partner, but we are truly attacking this challenge from so many different angles. We have so many youth-serving organizations who are wrapping their arms around youth. We have so many more people talking and working together in new ways. That's the kind of energy we need to sustain the kind of gains that we're seeing today.
Essential to a lot of what we've done, and I think the next iteration of this as well needs to be at the table, that for a long time our table consisted of law enforcement, child protective services, prosecutors, and we recognize that health is a partner in this work. That's when we gravitate to LifeBridge Health and Sinai Hospital and can be able to get these other medical and mental health services necessary to be able to help children with an impact. But there's a lot of other people not missing there. The fact that today's the first time you and I met embarrasses me, not because of you, but there's so many organizations in Baltimore, and I think that's how we continue to invite there. No one wants to have Thanksgiving dinner by themselves, right? That's not fun. I think the goal of Thanksgiving is to have a big dysfunctional family around a table, and there's a lot of different dishes that people bring together there, and so we often like to think that we like to host the conversation. We like to be able to convene what we built in our space, which when Ashley and I were planning this, when Tiffany and I were planning this, we were looking to do this so resident of our hope to have you in. It just happened to be booked today, unfortunately. But right, to be able to though have space where people can convene, so that there are in some ways too many of us out there having Thanksgiving dinner for themselves. And so how do we continue to draw more people in? And I think that the first slice at this is I think the work that Steph and I have been doing around let's stabilize things, let's drop homicide. The next step is who do we need to involve in this there? I mean, what you're doing, Joni, is violence intervention work there. You've got credible violence interrupters there. You're doing the same model in many ways that's been done for 30 years, ever since Chicago spun up pure violence. And so, that you and your colleagues should be part of that conversation of, what are you seeing? What are these kids seeing? That we as the adults at this point aren't even necessarily seeing on that there. And so I think that's where we start to go next is, how do you expand the tent, have a bigger table, have more people in the conversation, and what becomes really tough, I'll give you space to talk, right? But I think what becomes really tough is a lot of the oxygen just got sucked out of the room and the money, in the last 115 days from the Trump administration there. Let's go there. And, we've seen a historic drop and clawback of money that was going to fuel this effort there. We're on a precipice right now, so we've got these great numbers, right? Baltimore's no longer in the top 25 cities of the most violent cities in America. April was the lowest number of reported homicides ever in Baltimore City, which is 5. And we run the risk of reversing that trend because millions of dollars were abruptly terminated on April 22nd that was funding community violence work there. and not just community violence work. So sure, pity us and Broca and classrooms and the Black Mental Health Alliance for losing $1 to $2 million each there. The trickle down effect is going to affect you, and that as the administration has changed the fundamental way that government works there. There's just going to be less money in Maryland. And so we're going to have to find ways to swim together and make tough decisions and work together to be able to sustain this progress. In some ways, the work you're doing, is almost the plan B, right? That if we don't have the money to necessarily do some of the violence intervention work there, if we're building a baseline with kids now who can start mediating violence and working towards more positive solutions, then that's what will continue to sustain this there. But don't be fooled. Like this is, we're only 120 days into this year, and we really run the risk of all of this goodness reversing if we don't find ways to take action. And I think it's more than just, great, let's go raise more money. I think we have to figure out how we think different this time.
And Adam, you hit one of my pain points because Black Mental Health Alliance is a big partner of ours. And when everything happened, I mean, they had an emergency call for us, approved $200,000.
Right, we were sub-recipient of that?
Yes. And it was for one of our programs called Streets to Success, where you can come from any background in terms of how you make money, whether you snatch your purses or stealing cars, whatever, you can stop that immediately and come work with us under the Earn While You Learn model and start to put yourself in a better path. So like,
I think with these stories need to be told that, and I don't know what the Black Mental Health Alliance's strategy is. We're going to appeal. I encourage them to appeal. After I'll follow up with you and talk to them and say that you got to appeal this, because it's such a warped borrowing of classic old, and I hate to be all political, Republican, Democrat, but it's such a classic old reworking of the trope from the early 70s of the Nixon administration of this welfare to work kind of concept there. But it's earn while you learn, and these are smart concepts that the administration should be leaning into to say, that system does work.
it works.
Right, and but because they used AI, we're not live streaming this, right? Because they scraped all these grants to rip this stuff out there, that great programs that they didn't even think about it, and it just fell under the Bipartisan Safer Communities Act, gone. And these are programs that need sustenance. Yeah.
That's a great segue, because as you mentioned, we're talking about money. So on April 22nd of this year, the U.S. Department of Justice abruptly canceled over 360 grants nationwide, totaling more than $800 million as part of a shift in federal priorities under our current administration. And so these funding cuts obviously have implications for Baltimore and for the prevention, the infrastructure, and all of the great work that we're working towards. And so given that, do you feel like that's the biggest issue that you're facing right now? And you could answer yes or no. And then if it is, how are you navigating that? And so keeping in mind that it's in flux and it's unpredictable, we're living it right now. For all of you.
It's why I'm on my phone during this. It's like, we're working on the appeal, which is due in 36 hours. That it's definitely the biggest existential issue facing us right now. And by some rights, it's the tip of the iceberg of what comes next, right? Like, sure, maybe we could figure out, someone sitting in the audience or watching at home, who's like, great, I'll stroke $1 million check, and that'll be a lifeline for 9 months, right? Like, the next cut comes, and it just gets worse. And so I think it is this radical rethinking of, so how do we do this? How do we survive this next 2 to 4 years doing this work? Because we believe in it, we know it works. I think that is the biggest threat that exists out there right now. I mean, the whole dialogue changed. And look, I'm not naive to think that it wasn't going to happen to us. It was just a matter of when. Because you watched it happen to environment and to health and to education. It was only a matter of time before they turned to community violence intervention work. Yeah. And look, I mean, you're going to need the support more than I do, because I've got the backing of LifeBridge Health. That's one of the reasons we went to LifeBridge Health, is when I was at the small shop, that anytime the city of Baltimore, the state of Maryland, the federal government owed us money, we were outlanding, right? We were taking the loan. At least with LifeBridge Health, that they're not funding the program, they're funding a lot of infrastructure, but at least I can make payroll. I don't know how you guys are doing this, and it's terrifying. It's awful.
Yeah, just to kind of echo a lot what Adam was saying. Like, this is tough times, especially for us. And, you know, just being real with you guys again, like starting this organization, like I had no idea what I was doing. Like, didn't know anything about nonprofit or building up an organization. But, you know, I couldn't imagine making it 10 days, let alone now. We're in the year of our 10th anniversary, which is still crazy to me. But just using just some of that creativity, tapping into our heartbeats, our young people, and just really trying our best to diversify funding, because it really has shaken us to the core, but we're still holding on. And there's so many young people who need us, and if we don't open our doors, then I'm scared to think about what the repercussions of that is going to be. So, like, my real honest answer is that, you know, we really don't know it. We're just trying to figure it out every day as we go along, because we know that real young lives are attached to the work that we do. So
yeah, and for them, they don't care that it was an administration decision. They don't care that the Justice Department, you know, they just care that the person who was believing in them, and giving them a stipend and giving them purpose now says, sorry, I don't have money for you.
Absolutely.
And you become just another adult without that.
And Adam, I got 300 some young people on our wait list
I bet.
to work with
Right.
us. Like, on our, that's not the ones that
Yeah.
comment, that's on the wait list,
Right.
who raised their hand and said, I want a better way,
Yeah.
and I want to do something different.
Right. No one wants to be a victim of violence. No one wants to be
Yeah.
like this. They want a way out.
And I think, like, even before the past, 120 days, I think my answer to this question would have been just the work of needing to sustain and institutionalize the work that we're doing. We got a historic investment of federal dollars under the Biden administration with the American Rescue Plan Act. In many ways for us, it gave us almost like seed funding to create a brand new city agency to bring in the positions that we needed. Back when we were Mayor's Office of Criminal Justice, we had there was maybe a staff of like 17, 18. There was a much smaller scope of mission. There was no comprehensive violence prevention plan that this agency is responsible for implementing. And so we had to grow a lot. Today we're an agency of about 40, and that's like our sweet spot just in terms of covering all the areas that we've been talking about. But none of us sitting up here or who's been involved in this work are going to be happy if we say like, oh, remember that year when we got off the most dangerous list? We don't want to see things bouncing back. And so while we had this awesome like one-time investment and infusion of funds that helped us support much of the work that we're talking about here today, now the hard work has already been at our front door of how do we work with our budgeting team at the city to make sure we're growing the share of city dollars that go towards this preventative and interventive work, because we know from the research that when we can get at prevention, we can get at intervention. It is an investment on the front end, but you're saving so many costs, human, financial, otherwise down the line. So that's part of an ongoing effort. But even making sure offices like ours, we have a mayor right now who's a champion of our work. Institutionalizing our work is so important. We don't want the ways that we've been able to do our work, whether it's group violence reduction strategy, all this coordination we're talking about, or even our existence as an agency to be at the whim of any future elected official, political force, whatever it may be. And so we're also trying to take those steps to make sure that we can maintain and stay sort of as this non-law enforcement center of public safety for the work that we do.
Thank you. One more question, and we're going to open up the floor to questions. What is one thing that everyone in this audience, regardless of their role, can do to support violence prevention efforts in a meaningful way?
I'll say advocate. I think even just when you're in conversations, be it with family, friends, with your colleagues, like when you're hearing about public safety, when you're thinking about how people feel, making sure that you can give a voice to the fact that this is an issue, this is progress that goes beyond what law enforcement's doing, or it takes all of it, right? We have to care about prevention, we have to care about intervention, and continuing to give voice to that work, because I think what I've found, we have so many committed people in this space, they're so focused on the work, they're so focused on their young people, they're so focused on the people that they're doing case management and life coaching for, that they're tapped out, and so they need advocates, they need people speaking life to the work that they're doing in rooms that they're not in. And so I think continuing to just be an advocate for the fact that this is something that takes all of us, and we have to all be united in the fact that this is one of our central issues. This is something we're going to stay committed to long term, and continue to have at that level is so crucial and important.
Thank you, Joni.
Yeah, so I'm a little biased on this one, because for me, it always goes back to our young people, because not only are they our future, they are truly our now as well. And I'm probably preaching to the choir on this, but finding small ways to show up for our young people, especially the ones who are at the heart of the violence when it comes to Baltimore. Like, it's no secret, like Baltimore truly still is very much segregated, and a lot of the violence is stemming from the black communities with the black kids. But we have to find meaningful ways to show up for these young people, even if you can't relate, or even if you don't understand. There's so many pockets for each of us to be helpful and to be a part of the village that these young people need. We just had an event on Saturday, Youth Success Day. It is the first annual event of its kind where we're coming together to celebrate young people and their successes across Baltimore, across all pathways. We had over 300 young people come to celebrate. And they came because they wanted to share what they were doing. And while the graduations and all that stuff was amazing to celebrate, so many young people were talking about how they just finished their GED, or they just enrolled in their GED, or they just got off the box, or they had a goal to stop smoking and they haven't smoked now for 60 days. Those are wins, and those deserve to be celebrated. And young people notice when you show up and when you don't show up. And even after that event, I had so many young people come up to me and tell me, like, thank you, because I didn't know that so many adults, aside from HeartSmiles, really cared about us. Like, and just situations like that sometimes just kind of remind me and put me back in the frame, like, yeah, we are all about young people, but we need to get also more caring adults in front of young people so that they can see that nobody is against you, but everybody is really for you.
You know, kids, just building off that, I mean, kids don't vote, right? Kids don't make political contributions. You know, kids by and large aren't, driving the economy there. They're not, they're a target market for advertisers, but they're not the ones deciding, what car to buy, what soda to drink. It's up to us as adults. We're the ones who make those decisions there. And so I think it's what ends up systematically, for 50 years now that kids in America haven't had that. They needed us to advocate for them. I mean, sure, there's moments they mobilize, and we've seen these kind of great moments there, but by and large, it's up to us. And so I think, just both extending from what Joni said, is that we have to be able to represent there and advocate for these kids. I think similarly, we need to also intervene when necessary. Maryland Family Law 5-704, which I've spent a lot of time on in the last 25 years, requires us as adults that when we have reason to believe abuse has occurred, we're supposed to report it to Child Protective Services, law enforcement there, and as awkward, as uncomfortable as it might be, it's that central tenet that would have prevented Penn State and a lot of tragedies in the Catholic Church and in juvenile justice, and moments that adults didn't have the courage, the guts to be able to say, I'm going to stand for this kid, rather than I got to protect the institution there. And so we're required to do that. And so I draw that out to say that what can we do? I think that if you have reason to believe abuse occurred, if a kid comes to you and says that something's happened to them, if you suspect something is wrong, you need to get involved. And whether it's reporting abuse, whether it's seeing a family that's struggling under the weight of domestic violence, whether it's struggling under the weight of poverty, whether they kids shouldn't have to walk over a body on the way to school and just shrug it off. Like, that kid needs that support there, and I think it's that call to action that to sort of borrow the last quote from Rabbi Hillel. If not now, when, right? If not you, who, and if not now, when? And that's the call to action, is that we've got to be the ones to do this for kids, because no one else is going to do it for them, and that we can kind of drive them and empower them, and that'll get them there. But I think when that precipice comes, it's not their responsibility to tell us that they were a victim of something there. It's us to be able to listen to them and do something about it there.
Thank you so much. We appreciate all three of you being here and giving us your time and sharing about the fantastic work that you were doing within your organizations, and then also what you're doing in collaboration with other organizations across the city and the county. And so we thank you so much for being here. I want to open it up if anyone has questions. Yes.
I'm delighted to learn the progress of violence reduction in Baltimore, and I'm a lifelong Baltimorean, so this means especially a big thing. We're also on the books with, as an outlier, with overdose deaths, and David Simon's The Wire did a very instructional illustration, gave us of the intersection of the commerce in illegal drugs and the public safety priorities and reaction to those conditions, which I believe tightly intersect with the work you all are doing. This has clearly been a priority of the current mayoral administration. What can you all say about the intersection of the violence reduction work and the practices of our public safety workforce in the city government? Has that evolved away from kick ass and take names to the kinds of interventions that you have been talking to us about?
Oh yeah, I mean, I think that's evidenced by the shift of Mayor's Office of Criminal Justice to the Mayor's Office of Neighborhood Safety and Engagement. And I think that it's an and also approach, that it's not saying, and I think that's where a lot of conversation got lost in the last decade to some degree, that it's not one or the other. It has to be a level of both. That there's a level of responsible and important policing that's necessary, that isn't kick-ass take name, but is keeping communities safe. But to keep communities safe, it relies upon programs at all levels to be able to intervene and prevent violence from happening in the first place, whether it's with young people growing up, having a different path to go and learning, violence mediation skills, or having adults who are finding conflict and mediating them, and not even needing to get the police involved there. But so many of these, when I look back 30 years ago as a prosecutor, so many of the crap cases that clogged district court were things that police didn't need to be involved with, that have now, resulted in criminal records for thousands of young black men. And it's just wrong that's what the philosophy was. And I think what we're seeing now is we've got lower levels of violence now than we did in the 90s, by taking this balanced approach of focusing on both community strategies as well as policing strategies. And so it's never going to be one or the other, but it's an and also approach with it. One other asterisk, you talked about opioids, and I think that it would be, that's such a driving factor as to violence and the trauma. I think that kids also are impacted there. When you have your own spare time, go Google the Adverse Childhood Experiences Study, right? Or go to our YouTube page, youtube.com/LifeBridge Health Child Center for Hope. Go whole ACEs thing. But the Adverse Childhood Experiences Study talks about not only does it create a lifelong future trauma for children when they're victims of abuse or victims of neglect, but if they're living with if they're living with drug addiction in the household, that can impact their future trajectory. And if they've been impacted by violence at a young age, then their propensity of becoming addicted to opioids at a later age increases by 7 to 10 times. And so, there's another reason, like if we could just defend childhood, and if we could just work on these moments here to get these kids the right path forward there, that's how you're going to turn the tide in a lot of these poor metrics that we're fighting downstream on there. And good news, Stefanie's boss has access to a pot of money that I've been emailing her about, and her colleagues. Like, there's this opioid settlement money that Baltimore has that needs to figure out what to do with it. And look, it's not that this is the end-all be-all of it there, but like that's a part of this, is it can't just be using opioid to address opioid, but using it to address the root causes that lead to opioid use later in life.
And I think like so those funds that you mentioned, one thing I'll say, the overdose prevention work is something that from the very beginning of development of the comprehensive violence prevention plan, even though it's not violence per se, it's preventable death. It's also an issue that literally needs to have a public health approach taken to it, and not be rooted in like whatever makes people feel safe in the short term, like talking about what our law enforcement officials used to do, what their approach was. It was almost like a prioritizing of like these short-term feelings of safety, like seeing a response over long-term outcomes of safety. And so that's where I do see the shift for myself. I think one of the, we've been doing collaboration with the harm reduction community. We're involved in the, we play a leading role in the group violence reduction strategy, and so we've certainly seen intersections between violence and organized drug shops in our communities. I think the difference now, instead of taking this broad brush of, okay, this is a community that's known for having high violence, now we're going to police this in such a way that anyone who's outside who doesn't look right, like they're subject to arrest. That's been a shift, and so now it's very much a person-focused approach instead of just a broad place-based approach. And I think that's why we're seeing some of the numbers come down as quickly as they are, because we're actually getting to the right people. We're prioritizing those issues where we see, drugs and violence intersect. We're prioritizing the violence above those other factors, and so it helps lead us to the people that we actually have to make that intervention to. And because we're reaching the right people, because that's helping us get ahead of what is likely to be that next incident of violence, and we know at least 60% of our violence has historically been retaliatory violence, so based on an incident that's happened, someone coming to get revenge. For us to get ahead and break that cycle of retaliation and re-victimization, I think that's why we're seeing such a dramatic decline, and it's precisely because we're taking an approach that recognizes all of it. But it's been interesting because with the overdose issue, we know too, we got to be really intentional and make sure we're ready to mobilize those service partners. That's a role that we play because there's a good body of research that shows, sure, we don't want people selling drugs on our streets, but when you interrupt the operations of a drug shop, that can also lead to death because people are getting other products that may have other things in them. It's not the same person that they're used to working with. So we have to be really, really intentional and coordinated with all of that, but appreciate you lifting it because it's a big piece of it, and appreciate the words of support for the work.
And the last thing I want to kind of add is that, I have friends who are in law enforcement, so I know that there's some good people here. But I work very much in the pocket of pain. So I don't get to see some of the culture shifts or the good things that might be happening from a law enforcement perspective. Unfortunately, I still see a lot of the aggressiveness and just a lot of the disrespect. And the relationship between law enforcement and young people very much still broken. And unfortunately, I don't think that we've gotten to a place yet where young people look at law enforcement as protectors. Versus in some other communities, you're happy to see the police, because you know that that's your friend, you can have a conversation. And even me, where I am at my place of life, I still get nervous if a cop car pulls behind me because I'm wondering if this is going to be the second time that I get yanked out of my car. I was pulled out of my driver's seat window. I was 20-something years old, just trying to go to work and do my job. And they pulled me out my window claiming to be a felony stop. Meanwhile, I'm the cleanest person ever, ever. So just based off of my personal experience, I kind of carried that with me because I've kind of truly never gotten over it. But then now too, just to see the day-to-day with how law enforcement handles some of these children. And I was in a meeting a little less than a month ago, and one person in the meeting was a judge, a juvenile judge. And this person said, well, by the time they get to me, I know it's already too late. And that wasn't the time or place for me to try to debate that guy. But it also reminded me, wow, do do you really just see our 13 and 14-year-olds as a lost cause because they made a mistake? And now here you are, how dare you have this young person's life in your hand, but you've already made a prejudgment. You have so much power, sir, but you've already made it up in your mind that it's too late by the time they get to you, which is why the school to prison pipeline is very effective. It's working so effectively. But I know that there are good people within the law enforcement agency who wants to do the right thing and wants to change the culture. I just need them to be amplified even more, and I need them to do even more to try to have a ripple effect within the law enforcement community, because whatever they are trying to do, it's not enough, because it's not reaching some of the young people who I know, who I see every single day being harmed and hurt at the hands of the police.
I want to thank our panelists once again for coming.